session. So
you are the joint moderator today. Congratulations.
Thank you, sir. Thank you.
So hello doctors, students of homeopathy and lovers of homeopathy. Let's begin the session with a silent prayer. Thank you everyone. Today is the 1788th day of the uninterrupted daily webinar of International Forum for Promoting Homeopathy. As you all know, IFPH is conducting uninterrupted 3 sessions every day from 7:30 to 10:30 p.m. The recording of the session is getting uploaded on the very next day so that who missed the session can watch it and get benefited from this. So you can also subscribe the channel without paying any money. So today's our guest and speaker is Dr. B.J. Binduraj. He is an MD in homeopathy. He is the chief physician at Kurumpelil Kent Homeopathy and Wellness Center, Punalur and Kottakkara, Kerala. He is having more than 28 years of clinical experience as a practitioner. He is conducting classes and seminars on lifestyle disease and giving expertise in diet and exercise in Kent Wellness Center. He is a classical homeopathic practitioner. Along with that, he has an integrated system of treatment at his clinic, which includes therapeutic yoga, exercise, so that calisthenic exercise, that is new term for me. So please excuse if I am not pronouncing well. Diet therapy for rehabilitation and maintenance of health. He has presented and shared his immense expertise with us on this IFPH platform many times before also. He is also playing a very important role in moderating IFPH webinars. So today his topic is very interesting. He is going to present on the topic, Are you ready for the magic? Unraveling an age-old secret therapy. So I am proudly welcome Dr. B.J. Binduraj for today's session. Sir, please start your session and give us benefit of your knowledge.
Hi, Dr. Shruti. Now
Yes,
I am making you the host now, so that you have to change. I'm living and I am making you the host right now.
Okay, sir. Okay, sir. Okay, sir.
Yeah.
So Dr. B.J. Binduraj, sir, please start your session.
Thank you, doctor. Am I audible?
Yes,
Yeah,
sir.
you are.
Yes, sir.
Okay. Hello all. I'm Dr. Binduraj, and I'm 30 years I'm practicing Hahnemann in homeopathy. With the cardinals, the rules, considering the diseases as just aberrations of the deranged vital force, and finding the simillimum, considering the totality through a proper case taking. I was treating since many years, means 30 years. And while taking this session, are you ready for the magic? Just a minute. Unraveling an age-old secret therapy. I told you that I'm a classical homeopath or a Hahnemannian homeopath. So I thought I was still now also I am an orthodox homeopath, not having any other inclination to add anything extra in my practice. Means I doesn't like adding medicines, combined medicines, giving tinctures, biochemics. Likewise, I was not treating. From my beginning consultation time itself, I was implementing just single medicines, the least minimum dose, using various potencies wherever it is necessary. Likewise, I was treating the cases according to our master itself. And we all know the physician's high and only mission is to restore the sick to health, as it is termed. And the highest ideal of cure is a rapid, gentle, and permanent restoration of health or removal and annihilation of the disease in its whole extent in the shortest, most reliable, and most harmless way on easily comprehensible principles. But while I was treating and I was taking the case with the totality and finding the simillimum, considering the miasms, while I was prescribing, I tried to cure a lot of cases, but lot of cases while treating itself, I found a lot of obstacles to cure. Because of the current scenario, you all know, in our place also, very little exercise, full of persons were full in stress due to domestic, occupational, environmental problems and stress was affecting the person as a whole. And though well-selected medicines were given to them, the persons were not able to maintain their health due to the even the bad food also. So the diet, lack of exercise, everything was stumbling blocks to me. So that after several years of practice, I started another clinic, and I had a ample space to start a wellness center there. On that wellness center, uh, um, our moderator mentioned that these calisthenic exercises, along with mainly yoga and diet therapy, was implemented. And it proved wonderfully well that it is good for the persons to maintain the health, not to get the vital force to derange it again. So it was a great addition to our practice. But in the long run also, after some years of consultation, a lot of persons were not able to get come to our wellness center due to their work. They are when they were very far away from our clinic, it will be very difficult to manage them. It was a Herculean task. And I need to add another thing also. On my consultation and career, initially, I was also not that much confident on homeopathy because I studied homeopathy. And when I was a fresher in the field, I found a man who changed the whole thing. And that was Guru Nitya Chaitanya Yadi. In Kerala, he is very famous because of his intellect. He was a philosopher, psychologist, author, poet, and he had a great inclination and uh, very peculiar, very much proficient in lot of science, and he took great tasks in promoting holistic medicines and motivated me when I started my consultation. After his death on 14th May 1999, I got another man from his uh, disciplehood itself. That was Joseph. Joseph was a great traveler. He traveled a lot of places, and due to him, I found and I met a lot of persons around India and abroad also, because he was such a nice person and he was a walking encyclopedia. And once when he was at my home, I asked him to find or if there is any therapies going on in that place. Means he usually were in Himalayas and all. And I asked what therapies are there, because I was very keen in studying and knowing, understanding what other holistic therapies are there. But I was not using it in my practice, but only yoga and this exercises was only there doing. I was implementing. Just a minute, I need to admit some persons. And once when he was at Himalaya, he telephoned and asked me whether I need to join a course which is being conducted at Haridwar. It's a very special thing connected with Marma. Marma was not a new term for me because in my adolescence, I studied this Kalari, because in Kerala it's very common to study and it's very easy to get an acquaintance with that. Marma Chikitsa is very popular in many places as a traditional skill. In Kerala, it is being connected with Kalari. And in Tamil Nadu, there is Varmology, a science. Bone setters, Nadi Vaidyas, and Kalari experts practice this specialty. But nothing more than as a traditional skill, which had no scientific explanation behind it, and it was limited to some traumatic lesions of muscles and bones. So I was also not that familiar with these things, but I was keen in studying this Kalari. And I just need to mention what Kalari is. Kalari Payat, Kalari, and in these Kalari Payat areas, means Kalari training areas, some Vaidyas will be there. There won't be much proficient in treating other complaints. They will be well versed in treating some injuries and all. And I need to show you some Kalari things, how Kalari Payat. So this is what is Kalari is in Kerala. And to study this more proficiently, and Josephji told that there in Haridwar, Dr. Sunil Kumar Joshi and team is conducting a great program over there, because he is considering this science as a science, and the nuances is being taught in that place. So I thought of to go to Himalayas first, and considering this as an opportunity, I tried to venture to that place. And I reached Himalayas, and at Haridwar, I met this wonderful guru, Dr. Sunil Kumar Joshi. Professor Dr. Sunil Kumar Joshi is the former Vice Chancellor, Ayurveda University, Uttarakhand, Professor and Head of the Department in Shalyatantra, Gurukul Kankri State Ayurveda College, Haridwar. And I started studying what Marma therapy is. It's a Gupta Vidya, hidden science. King and his physicians kept it. In Susruta Samhita, oldest available text on surgery in the world, is being mentioned. As a rapid-acting solution, Marma therapy is found. Instant, permanent, natural, non-invasive way of healing. Marma science and Marma therapy is an untouched chapter of Indian surgery. You all know about Susruta, Charaga, Agastya, and all. Initially in our place, Ayurveda was having wonderful gurus and Vaidyas. And on that time, they even had highly precision instruments, which our current day plastic surgeons are using. But once Hinduism was suppressed and Buddhism was active here, invasive procedures like surgery was not allowed. And Vaidyas during that time changed their treating pattern because they was pressurized not to do these surgeries, invasive procedures. And they become proficient in doing various other things and found these marmas. In Sanskrit, hidden or secret is the word meaning of marma. And they try to treat these applying pressure and some tactical thing applying on the vital parts and treating the person with that. With the exploration of Marma science, the whole scenario of Indian surgery will change. This astonishing and wondrous method of treatment originated in the 4 Vedas and was further developed and explicated by Susruta. This knowledge was transferred to other countries through the spread of Buddhism to Southeast Asia. And you all know, after several years after this, Buddhism was stronghold in India, and after that, when Hindus again became prominent here, Buddhism was wiped to Asia's many other places like China and Japan and all. And here, acupressure, acupuncture, these type of therapies were prominent, became prominent, and many doctors became proficient on that. According to Maharshi Susruta, there are 107 Marma points. These are very important vital places. Any injury to these parts may lead to severe pain, disability, loss of function, loss of sensation, and death. According to anatomical consideration, marmas can be divided into Mansa marma, Sira marma, Snayu marma, Sandhi marma, and Asti marma. Not superficial landmarks, deep-seated, important physio-anatomical structures. The specific parts of the body which are very vulnerable to trauma is known as marma. Till date, the knowledge of marma science is not well known even to the practitioners of Ayurveda. Could fight against diseases with marma science, pranayama and asanas, along with holistic healing medicines. It also guarantees the elderly and disabled to improve the quality of life as well as the rehabilitation. So while attending the session and all, I found a lot of cases getting benefited by marma therapy. And it was a very wide practical session was also added. Dr. Sunil Kumar Joshi was leading the sessions, and he was teaching us all the marma points, how to identify how to give the pressure techniques and all. He was guiding us. What not to do was the main thing he was teaching us, because it's very vulnerable. If we are giving any undue pressure, or if our interpretation is not correct, it will lead to many harms also. So he was teaching us likewise, but the technique was wonderful. It was giving quick relief to the persons. Many doctors of various fields were attending the session, and every 6 months after the session was being conducted, and we need to go to the session, and I had several sessions there. Marma therapy contributes to increase or recharge physical, mental, and spiritual energies. On the physical level, it helps to revitalize or re-energize body tissues. At cellular level, it improves the vital functions like digestion, respiration, blood circulation, and excretion. On the psychological level, it improves the mental faculty by directing it in the positive direction. It harmonizes the functioning of nervous and endocrine systems to control psychological disorders. On the spiritual level, regulation and transformation of thoughts in the positive direction. As a preventive measure, it helps to cope with the situations arising from different diseases. During attending the session, we were taught to do self-marma therapy. Daily we can do that, and we can activate the marma points. And that SMT is very beneficial. If we are doing SMT daily, it is equal to do pranayama and asanas together. And within some minutes itself, some 10-15 minutes itself, we can stimulate our mamas, and that was a wonderful thing that we can make our mamas very much proficient, that we can guard us from any disease happenings. And I am just introducing some marmas you need to study, you need to just know. It's one is Shipra. The Shipra is a point just in between the thumb and the index finger. When we are giving the right pressure on that part, we can treat lot of even frozen shoulders, because the radial nerve is being the branch is being coming here, and if we are stimulating there, we can treat lot of complaints arising from the cervical region downwards. In the hand, Shipra Marma, and in the legs also we can find Shipra Marma. Talahridaya Marma. This we can found in middle of the foot and in the hands itself. If we are rolling our fingers, and the place where the middle finger touches the palm of the hand, there is the Talahridaya Marma. This marma is associated with the functioning of respiration and circulation. It controls the respiratory system and circulation with heat reception on the skin and the feet. It boosts the immune system. It controls the right foot and left foot along with the power of circulation. And marma points, various marma points distributed on our body. These are all being taught with anatomical connections also. What places we need to stimulate. Avarta, Utsheba, Shankha, Banka, Stapani, Pana, Srinkataka. Likewise, marmas are marma of upper extremity, Shipra, first metacarpal ligament, Talahridaya, palmar aponeurosis, Purcha, carpo, metacarpal and intercarpal ligaments, Purcha Shira, lateral ligaments of the wrist joints, Manibandha, wrist joints, Indravasti, origin of palmaris longus muscle, Purpara, elbow joint, Ani, tendon of biceps muscle, Urvi, brachial artery and basilic vein, Kakshadhara, brachial plexus, Lohidaksha, axillary vessels. Marma of lower extremity. Here also we can find Shipra and Talhridaya. First intermetatarsal ligament and long plantar ligament is the anatomical place where we can find it. Kurcha, tarsometatarsal and intertarsal ligament. Kurcha Shira, lateral ligament of ankle joint. Gulfa, ankle joint. Indravasti, calf muscles. Janu, knee joint. Ani, tendon of quadriceps femoris. Urvi, femoral vessels. Lohidaksha, iliac vessels. Vitappa, inguinal ligament and inguinal canal. Marma of abdomen and thorax. I am just mentioning the name just to, I need to mention these things. Guda, anal canal and anus. Vasti, urinary bladder. Hridaya, heart. Stanamula, internal mammary vessels. Sanarohida, lower part of pectoralis major muscle. Abalapa, lateral thoracic and subscapular vessels. Abasthampa, two bronchi. Marma of back. Kadikataruna, sciatic notch. Kugundara, sacroiliac joints. Nidamba, ischial tuberosity. Parsha Sandhi, common iliac vessels or renal angles. Vrihadi, subscapular and transverse cervical arteries. Amsha Bhalaga, scapular spine. Amsa, coracohumeral ligament. Trapezius muscle. Marma of head and neck. Nila and Manya, right and left common carotid artery. Matrika, blood vessels of the neck. Cricardia, atlanto-occipital articulation. Vidura, posterior articular ligaments and vessels. Bhana, Kieselbach's plexus in little area. Abanga, zygomatico-temporal vessels. Avarta, junction of frontal molar and sphenoid bone. Utshepa, temporal muscle and fasciae. Samgha, temples. Stabani, nasal arch of the frontal vein. Simanda, cranial sutures. Syncataka, cavernous and intercavernous sinuses. Adhipati, torcular chirophyly. So these all things we can read and study from the book also, Marma Science and Principles of Marma Therapy by Dr. Sunil Kumar Joshi. And it's time for a little bit of a practical session. Means I need to just show you how these things are. And so from Shipra itself, we can see where Shipra is. In between the thumb and the index finger, there's a verb, isn't it? Here we can place our finger and we can hold our finger like this and press for 15 minutes. This will relieve pain of the shoulder, neck, stiff neck, etc. So if you are pressing it for 15 times, just 0.8 seconds apart means a breath while we are inhaling, and after exhaling we are just pressing it, and once after inhalation and on exhalation we are just pressing it for 15 times. That is, in a minute we can press and activate the Shipra Marma. And this Talahridaya, we can roll our fingers. We can see the middle finger, where the middle finger is touching the palm. That is a place where Talahridaya is. This Talahridaya is a wonderful place which we can stimulate, and we can control our hypertension or hypotension. And these are very excellent. Dr. Boblim is saying that is some meridian points. Yes, it's connected with some meridians also in acupressure, acupuncture like ways. And the other thing we need to know about the other, one of the other thing we need to study is Srinkataka. Here in the root of the nose here itself, we can press for 15 times and we can activate the power of our eyes. If you are using a spectacles and you are struggling to see something, without spectacles, it is very difficult. You can just pinch your nasal bone here, not deep into the deep down, because it will make this fibrosis. So never do that. The soft tissue is there, so never do that. Do it in the nasal bone itself here. Sringrataka. 15 times you just press, and without the spectacle you can read. This is a wonderful effect it is having. And connected with this Sringrataka, and there is another marma point here beneath our pinnae. Here we can close our pinnae and press it and release it. We can control this vestibular imbalance, tinnitus. This type of thing we can control by just pressing it 15 times and doing this Sringrataka together. This together will yield benefits for these things. So these are all wonderful things which in holistic treatment procedures, there are a lot of wonderful treatment procedures we can add to our system of medicine, because in homeopathy we are using constitutional medicine, constitutional simillimum and all. And if some persons, if we can provide instant relief for their local affections, we can use this, because I don't like to use this local acting, these pathological based prescriptions given to the persons, because when I am always treating the person, I will look for the totality of symptoms, and if there is some positive symptoms, I can add this also. And for some old age persons who is really suffering from various problems, we can show them how they can stimulate these marma points and they can gain benefits out of that. Another marma point is Phana marma. Here, there is a small depression over here. You can place your little finger here and just check that there is a foramen over here. You know it on in your face itself, it's there. And you can just press with your little finger. Just the correct measurement is there. You can press, release, and that also you can do it 15 to 18 times. This also you can use for this anosmia. Lot of problems you can use this also. Likewise, in our body, lot of pressure points are there. And in our clinic, along with this wellness treatment procedures, we are now incorporating this also as a treatment mode. And it's getting immense benefits also. So just to roundabout, marma treatment improves the range of motion of joints by working directly on the soft tissue, muscle, tendons, connective tissues, etc. The lessening or disappearance of pain by relaxing the nervous system and releasing the tension in soft tissues, as well as removing waste byproducts after injury. Means this increase of blood flow is being enhanced by the correct stimulation of the marma joints. And I found a lot of cases over there in Haridwar itself. I have found a lot of cases with persons suffering from hemiplegia, a lot of motor neuron complaints, Parkinson's disease, even autism spectrum disorders and cerebral palsy also will get benefited by doing this. We can teach the person, the patients, to do the right thing. We need to just monitor, first of all, what they are doing, and we need to just guide them not to do the wrong things. This is the great thing which I learned from there, and I just need to make you all know that there is another treatment procedure over there. And if you persons can add more, or if you need to ask something, I can add it again. So the discussion, I think it's open. Now we can go for the discussion also.
Thank you, sir. So now I would like to ask the participant if they have any question. They can either raise your hand or you can type in chat box. Sir, one question is already there in the chat box. So Bob Lim, he's
Yes,
asked that are
let's
those.
let's
Yes,
unmute him.
yes, sir. Yes, sir.
He can add something also from his place. Is he there?
Bob Lim. Now you can
Oh,
ask.
yeah. Yeah, Dr. Vijay BINDURAJ. This has been a very special and what do you call a special insight into another area of health management. I thought I would like to ask you what are the points that you can use for Parkinson management?
Parkinson's management, we can just, first of all, we need to stimulate the adhipati marma here. Okay, it will stimulate the hypothalamus here is adhipati. We can just measure here where it is by just placing our thumb and placing our middle finger where it reaches. Here, this is adhipati. Okay, we can press it. First, we need to breathe in. While exhaling, we can press down for a moment. A light press, because this is Panchendriya, means 5 senses is being represented by these fingers. Just press it down, release. Press it down, release. Along with that, we can do this Shipra and Talehrudeya. I mentioned you what is Talehrudeya. Shipra, Talehrudeya, and in legs there is Gulfa. There is a point near the medial malleolus, and we can see, we can find this sciatic nerve. There's a branch passing near the medial malleolus. We can trigger that point, and we can do pressure points, Shipra and Talehrudeya on the soles, on the foot also. So foot, hand, and we need to start first on Adhipati. So these are all the things, and Srinkataka will also benefit because we need to correct the these motor neuron diseases, Parkinson's disease, these type of things. We need to stimulate lot of marma points. I can't mention all things on this webinar. Just I am mentioning the cardinals. So you can add more because you mentioned about some meridians. What do you think meridians is? In your place, are you proficient on that?
Okay, thank you very much.
Can you add something?
No, I think most of the points you mentioned are very good for this to improve the health, especially the one on the thumb, between the thumb and the index finger. I think we do that every day. Then and the other one is for the nervous system. You have mentioned the mama point on the middle of the feet. That one is the kidney point in Chinese meridian. Kidney
There is
point
one
number one.
place here, just below the cubital fossa, this bend here. After the cubital fossa, if we are placing 4 fingers here, just down below the cubital fossa, and after the 4th finger, there's a place just midline on the hand. It is Indravasti. It's a Vasti Marma, means we can get benefits on kidney complaints and urinary bladder complaints on this point. We can just place and we can just touch and find the softest, that wonderful place where we can feel that marma here. No other place we can get that sensation. On that place we can get that, and it's good for urinary complaints, urinary bladder complaints and all. And if we are adding some other points, we can treat this prostate hypertrophy also with these right pressure techniques. Dr. Manoj is here.
Thank you, Dr. BINDURAJ, for your wonderful presentation. Everybody must congratulate you because it is we have to raise a complete physician, become a complete physician. So Hahnemann has got such a ability because he was the animal magnetism as mentioned there. Definitely. Then again, the sentient nerves, as mentioned by Master, I think it is these energy channels, not nerves. So, but unfortunately, we are interpreting it as nerves, but it is energy channels, as I mentioned. I got information like that. Okay. Anyway, I have a doubt about what about this treatment of this peripheral neuropathy in such cases.
Peripheral neuropathy means this type of things. We need to stimulate lot of points.
Yeah.
Where lot of points. Lot of points means we can't do for 1 or 2 or 3 or 5 points only. It's not like that. Here it is Amsa, Phalaga, Krigadiga, Kuguntra. Lot of points are there. These all should be pressed and released. Only press, just a little bit of pressure and release is the only thing needed. Because if the person is coming with a bystander and all, we can just teach the person to do these things, this bystander, that they can do it in their home itself. No need to come over to our clinic again and again to do these things, because 1 or 2 times we need a consultation again, and we need to have another second watch or second consultation. But we can teach them and they can train themselves. Even thyroid dysfunctions, this nodular thyroid is on the rise. It's a menace to even homeopaths taking the right medicines. This thyroid solitary nodules means this nodular goiter is not getting enough benefits with our medicines. I think like that, because a lot of persons are doing giving these locally acting medicines also. So for that also we can give them. We can teach a lot of thyroid stimulating exercises to control the pathologies in the neck, doctor.
Okay, thank you.
Thank you, doctor.
One more question is there, sir, in the chat box. It's from Dr. Salu.
Hi,
Just
doctor.
give an immediate response to any minimum number of times we should do. What we should be careful while doing this. Careful about doing this, because some parts of the body is having sometimes the tissues will change if we are not giving a right amount of pressure, especially Janu Marma beneath the popliteal fossa. It means beneath the knee. If we are doing the Janu Marma for the knee disorders, osteoarthritis, or you all know a lot of knee problems and osteoporosis and all, we can do and get benefits to person, give benefit and gain benefits to the patients. But if you are not doing it in the right way, if you are doing it in the just in the back itself, fibrosis will cause. And in Srinkatak also, there is a danger on doing this. And lot of marmas are here in the head. Never to overdo that. In the Manibandha, a marma is here. These are all very sensitive marmas. In Kerala, we all know these marmas are being used to disable the opponent or even kill or harm the person. So these ways marmas are dealt in Kerala in this Kalari Paita and all. So in therapeutic purposes, we are just stimulating these marmas, and some marmas we need to be cautioned on. So for that we need a lot of trainings. So that's why I am having repeated classes. I attended a lot of sessions. You all can learn these things over going there, but you should regularly. You need to go. Contact classes are there. You should be there. We can't study just by watching a video, just by reading a book or likewise that. It's very difficult. And does this give an immediate response or any minimum number of times we should do? Yeah, we need to do in the morning and evening. Morning and evening. If we need to get benefit out of this, just 2 times we need to do. Only about 5 or 10 minutes it will take for a person to do these things. It's very economical also. We not need to give the doctor or again and again fees, because we are studying that and we are doing it in our home itself.
Thank you, doctor.
Any more questions?
Doctor, one more thing. I think after the food, it will not do, no? After some time,
Yeah,
after one.
yeah. The thing is, some marma points, if we are going to stimulate, we shouldn't do after eating food. Especially this kurpara, a point is here, kurpara. And this is for digestive disorders and all. And this shouldn't be done after eating food. And some other also regarding connected with the abdomen, that also after food is not wise. So that is that's why I asked you, said that it's wise to do in the morning and in the evening before food itself. Anything more to ask? And I know this is a different thing, not connected with homeopathy. All will be just astonished what he's saying. It's not. But the thing is, it's a right thing. Likewise, Dr. Manoj said, Dr. Samuel Hahnemann promoted mesmerism, animal magnetism, and all. And this type of thing is not harming or interfering our medicinal administration. If we are giving the right medicine, and if as adjuvants, if we are giving these things, also yoga, also excellent thing is happening in our wellness center, because with yoga and this thing, we can rehabilitate lot of patients, especially geriatrics can be benefited by these things.
Yes, sir. And sir, I want to ask, sir, for autism also, and for hyperactive kids also, if anything is there to reduce their hyperactivity for ADHD?
Yeah, sure, doctor. There is a gulfa marma, means near the medial malleolus, there is a gulfa marma. While we are stimulating this gulfa marma and shipra, we can control this ADHD, attention deficit hyperactivity disorder, or this type of things. We can control that. That's a great boon also. But with homeopathic medicines, I am not giving much importance for that, because with homeopathic medicines itself, we can control hyperactivity well. So I am not doing that much.
Okay, sir.
Dr. Hubert raised the hand. Dr. Hubert.
Please, doctor. You
Hello,
can ask.
doctor. You made everyone with marma treatment. So I want to ask you, doctor. Hahnemann said that there are passes while using the passes in the mesmerism. In negative, there are some passes, positive passes and negative passes. Sometimes it may affect the person. What is about the scientific explanation for it?
Doctor, I am not proficient in mesmerism, but in my initial practice, I tried to learn hypnotism and all, but I was not, I didn't get a good trainer. I tried and went for a while. I am good with theory, but I am not well in practicals. And mesmerism, I don't know much. And it's not connected with marma. Our subject is entirely different.
And that is above the body. That is within the
Okay,
body and our hand. They are passing
okay.
through this passing. We are not touching the person, and but at the same time passing from upward to downwards for some times. And
Yeah,
that's a
maybe
method of
there is an
passing.
energy field over there, and
Yeah,
in Reiki and all, we heard about that, but I am not also proficient in Reiki. I don't know. I never studied that.
I have one experience in this, in Art of Living, we have different type of marma treatment. There they are doing like that. The pressure points that marma, there they are giving the hands, and then they feel something different, that energy, like that they are doing in Art of Living.
In Kalaripayat, there is a thing called Noku Marma. In Kerala, some Kalari experts know about these things. Means if we are just pointing the person with their index finger and just doing like this, the person will be disabled. They will get unconscious also. This type of thing is also there with this coloripate and all, but in our session, this type of thing was not being taught, because Dr. Sunilkumar Joshi is the head of the department of Shalya Tantra in Gurukul Kankri Ayurveda College at Haridwar. And he is just after science and how to unravel these things, the mysterious things, which because these are all things we can connect with the anatomical structures and all. But the other things like this Nokumarmam and all, I never had classes from him, so I am not aware of these things, like Didi ma'am told. Okay, it was nice, great.
Well, this was used in the treating elephants, the mahouts. They control the elephant by using this method. Otherwise, it's
They
not
are
easy.
saying that.
No,
They are
I'm
saying
talking
that
about that
to
marma, no? That is
uh,
different. In Ataflin, they are not using for bad thing. That is using, this is a different therapy. Not like that. In this also, I also learned this marma therapy. This is we are giving pressure point. That other they are not giving that much. They are just touching like that only. Like that in Art of Living they are doing that.
Tundu Marma. Tundu Marma.
Kunduvarma.
That's the pressure, the
There is
power
any-
they are using, that pointing, that pressure, they are concentrating all through these fingers and passing it through the person.
Yeah, Chunduvarmam,
They are,
Nokumarmam, Nokumarmam.
Doctor, there is any marma point in forehead and foot?
Yeah, lot of. Forehead means I mentioned about that Adhipati, and lot of other Apang, Havarth, lot of points, Krigatika. And these points are all in the head.
In
Sira,
forehead?
Stapani, Srinkatak, Simanta, Pana, Vidur, lot of points. And it's very we should be proficient in doing this, because it's very dangerous to apply wrong pressure on the head. So persons or patients are not taught all those points, because that points they can't do alone. So there's the application method means this is the closed lotus posture. Likewise, if we are giving pressure, lot of pressure points which are very dangerous will be benefited, because we are not directly applying pressure. And beneath our beneath our palm itself, we are giving the right pressure to that point. Here, there is an action, and another is open lotus posture. This Prana, Trinkataka, Apang, our hands, this wither is being given pressure. This is the open lotus posture. This is
For headache, what can we do?
headache. We need to, first of all, we need to press the Talhrudaya on both hands. If you are having hypertension persons in your clinic, you can just press the left hand of the person 15 times and just check the blood pressure. It will be much down. In the instant, within minutes itself, we will get that result. In the on that instance itself, we will get. On the left hand, we need to do that for hypertension.
Okay. Marma treatment also a vast subject.
Yeah, it's a vast subject. Yeah, I'm just a student.
Headache, we can use this one, no? This Shipra also.
So for what?
Headache, if they have migraine.
Shipra is also will get benefit. Shipra we can do, and even Srinkatak, Apang also will get, because during headache we will just hold this likewise. And if we forget something, we will press the Srinkatak to remember. Naturally, we will press here. Oh, what I forget. This is the thing. We are just pressing the Srinkatak. Okay.
Okay, time is.
Yeah, you can conclude, Dr. Sudhi.
Now we can invite
Yes,
Bobby
sir.
for vote of thanks.
Thank you, Dr. Binduraj ji. Very nice, excellent session. A special case, acupressure, the Ayurvedic treatment, acupressure and natural treatment. Prevention of disease in treatment of marma therapy.
Thank you, sir.
It is not gently. Homeopathic, there are three fundamental laws: gently, rapidly, and permanently cure. Marma treatment is the not gently. Marma treatment is the curative way and permanently way, not gently way.
We can gently apply pressure. That it will become gentle. Never do it or do that. That's the thing.
Thank you. Thank you. There are 5 points prevention of disease. Any animal barking in morning, 50 minutes barking in morning, and 1 minute jumping downward to upward, upward to downward, and 5 minutes dilate and circulant. जैसे ऐसे circulant, it is just point. Circulant. So it is approaching style. Approaching just like organon of organon, approaching style. Write the organon approaching style. So jumping upward and downward and dilating and constructing sikulna, phalna. So the
Good, doctor.
prevention of.
Thank you, sir.
Thank you.
Yes, sir. The
Let's
time
conclude.
is getting over now. I would like to call Dr. Bob Lim for vote of thanks.
Okay, thank you very much, doctor. Can you hear me?
Yes, sir.
Hello?
Yes, sir.
Yes,
Yes, sir.
yes.
Okay, on behalf of the IFPH, I would like to say thank you to Dr. BJ Binduraj for successfully conducting the 1788 uninterrupted webinar for IFPH, and he has brought up a special topic tonight, and it is called Unraveling the Old Age Therapy, and it brings us clearer and better insight of these secret, what they call that, mama points that could help us in our endeavor to improve the health of the masses, of the people around us, and including ourselves, because sometimes I also use this type of pressure points to improve my health. Thank you very much once again, Dr. BJ Binduraj, and I hand it over to the moderator of IPH. Thank you very
Thank you,
much.
sir. Thank you so much. So thank you, Bob Lim, sir, and thank you, Dr. BJ Binduraj. It was really a very interactive and very enriching and very informative session. It's opening a new aspect to think and to practice and to learn. So it is very much interesting topic and quite new also. So I would like to thank you for introducing us a very new aspect of this treating method. And I would like to thank everyone for joining this session and making it very much interactive and very much successful. Thank you, sir. Thank you, everyone. Now I'm handing over this session to Malayalam session. Thank you, sir.